Welcome to the Da Vinci Academy Histology video course. The entire video course is available on YouTube and covers all of the fundamental principles of histology and relevant cell biology. You can find all of the videos from the course by clicking the histology playlist link in the description below, and then you can access the corresponding practice questions and histology lab videos by going to our website, which is also linked in the description below.
Hi and welcome back. Here we'll discuss the apical specialization of the epithelial cells and the tissues themselves and practice some pattern recognition of the epithelial tissues. Since we've discussed the lateral and the basal borders of the epithelial cells pretty closely, it is now time to turn our attention to the apical surface and see if there are any specializations there too. And you can bet that there are. We'll start with microvilli. These are short, slender, and finger-like projections that kind of extend out into the external environment. These structures are designed to increase the surface area of each epithelial cells that have them to come in contact with any content that is traveling through the external milieu. And of course, increased surface area means that we can host a lot more receptors there too to grab onto what we need, transport it through the cell, then into the connective tissue, aka our body. And comparing a similar cell of the same size, the surface area without microvilli is much smaller than the surface area that is undulating along the microvilli. Histologically, the microvilli collectively kind of look like this lovely, fuzzy, uniform structure on top of the epithelial cells. And at higher magnification with, say, transmission electron microscopy, higher resolution of one of these microvilli will show that each microvillus contains an actin fiber as its kind of cytoskeletal core that provides the structural support and rigidity to the microvillus. And actin cores being non-motile structures means that the microvilli themselves are also not motile. Microvilli are covered on their exterior by glycocalyx, which is a collection of carbohydrate-rich molecules which react very well with periodic acid Schiff. So they stain positive with PAS, which shows up as a lovely magenta-colored region. And the microvilli plus the glycocalyx are collectively called a brush border for their brush-like appearance here, which is, again, coming in contact with the external environment. And microvilli are typically located en masse in small intestine. That makes sense because we have the food substance or chyme that is traveling through the gut tube, and we want as much of those nutrients to be transported into the body. So we need lots and lots of surface area there. And next we have cilia. These are also apical cellular extensions that project out into the external environment. But unlike the microvilli, these projections are much longer and thicker, and they actually lack the glycocalyx coating like the microvilli. So in this image, we have the epithelium up here and the connective tissue below, and off of one of these cells, epithelial cells, what we are seeing are these projections that are the cilia. In terms of distinguishing the cilia from the microvilli, because they can sometimes look very similar to each other, all we have to do is kind of trace the outline of the cilia or outline from the external environment of that epithelium. And what we see is that there's this kind of tufting or undulating, uneven tracing line that is different from the microvilli, where off of the cells, the brush border comprised of the microvilli and the glycocalyx tend to form a lovely and pretty linear and smooth outline like that. So that's one of the criteria that you can use to distinguish cilia versus microvilli. Furthermore, When we make a transverse section through one of these cilia and look at one cilium under the transmission electron microscopy, what we see is that the core of the cilia is comprised of the exoneme as opposed to the actin fibers. The exonemes are comprised of 9 doublet of microtubules and 2 singlet of microtubules. So it's 9-to-2 arrangement is typically called the exoneme. And off of the doublets, there are these dynein arms that extend out and interact with the neighboring doublet. And this interaction is what allows the cilia to be motile, to bend one way or the other. The motion then creates the current in the fluids that the cilia are kind of floating in. Cilia play a critical role in the respiratory system as well as the reproductive system. In the respiratory system, we have all these ciliated lining in the upper respiratory tract that constantly kind of bring up the mucus and dust or dead cell debris and things like that from down below to our pharynx and oral cavity or nasal cavity. And in the reproductive system, we of course have the ciliated epithelium in the uterine tube, which creates current to draw the ova into the uterine tube, then into the uterus, as opposed to the ova kind of falling out into the peritoneum. Furthermore, during embryonic development, cilia play a significant role in our axis establishment. Essentially, the right and left asymmetry is established by the cilia beating in one direction to create a concentration gradient of morphogens. So in clinical conditions called ciliary dyskinesia, the cilia are dysfunctional, which means patients that are affected by this condition have immotile cilia, which then results in kind of chronic respiratory infection in these individuals. Patients also tend to be infertile, and in some patients, we may even see the right and left asymmetry that is flipped like a mirror image, a condition called situs inversus. All has to do with cilia. And then we have stereocilia. Now, these are also apical cellular extensions that project all the way into the external environment. But these projections are actually the longest of processes that we've discussed so far. And sometimes these distal ends of the stereocilia will even branch, as shown here. Histologically, here is our epithelium. Here's one environment. Here's another environment, which is the connective tissue. And within one of these epithelial cells, perhaps this one, we're seeing these kind of wispy, hairy projections extending into the luminal environment. And when we try to trace the outline of this stereocilia forming an interface with the external environment, we'll quickly find that it's relatively difficult because of all these fuzzy undulations that are very irregular compared to the cilia and the microvilli. So that's one of the criteria that we can use to distinguish stereocilia from cilia and from microvilli. Although there's cilia in its name, this is actually a misnomer because stereocilia has actin in its core as a structural support, not the microtubule-derived exonemes, which means the stereocilia are actually non-motile as well. So think of the stereocilia as really long and branchy microvilli. In terms of their function, they're there to increase surface area for absorption of materials. They're typically found associated with male reproductive tract, such as the epididymis and vas deferens. And lastly, the apical surface specialization that is put on by the epithelial tissue, not the cells, but by the tissues themselves, is the keratinization, putting on a layer of keratin. This is unique to the stratified epithelia of the skin and some parts of our oral cavity, areas like our gingiva, where we're coming in contact with frequent force and friction. And what keratinization really is just a layer of dead epithelial cells that are still hanging onto the living cells underneath. So these dead cells are essentially providing an extra layer of protection against any microbes that we might come in contact with or force and friction. And here's a keratinized epithelium. And I hope your eyes are already going here to recognize an epithelial tissue, since we've been doing some pattern recognition practices throughout this lecture. We can see that this is an epithelium because we're seeing lots of cells with their nuclei all crowded together, and they're little to no ECM. And you might also start to recognize that some cells, as we're getting farther away from the connective tissue here, these cells are starting to get flattened out. I think this is a good one. This cell is flattening out. There's still nucleus indicating that these cells are flattening, but they're still alive. But beyond that, we have a layer of this kind of wispy, laminated appearing eosinophilic lines. These are all dead epithelial cells that are hanging onto the living cells underneath. And of course, from the apical most surface, some of these dead cells will start to flake off by thousands in a day. And then luckily we have these stem cells at the basal layer of the epithelium that divide and send up their daughter cells to replenish this entire epithelium and maintain it. So that's our skin. We're essentially walking around with this dead carcasses of epithelial cells all over our body. Now that we've covered all the bases of the epithelial cells, let's now discuss some details of epithelial tissues themselves. As a reminder, we've already talked about the two different types of epithelia. One was the lining or covering epithelia, and the other was the glandular epithelia. And in a diagram like this, the covering epithelium would be something that has about the same surface area in contact with the external environment as the surface area that is in contact with the basement membrane and the connective tissue. Whereas the glandular epithelium is often embedded within the connective tissue environment, and the surface area in contact with the lumen would be much smaller than the surface area in contact with the basement membrane and the connective tissue. With that in mind, let's see if we can start to pattern recognize and train our eyes to identify the epithelial tissues in this image. You're welcome to pause the video and attempt to identify as many epithelia as possible in this image. Here are some pro tips. Remember, epithelial tissue forms an interface between the two different environments, so find an interface. We also know that epithelial tissue is cell dense and ECM poor, so identify an area where there's a lot of cells or crowding of nuclei might be a little bit easier to see. See if you can identify basement membrane and confirm that there's polarity in this epithelial tissue, that there's an apical surface and the basal surface, as well as the lateral surfaces. And then we can determine what we think is the epithelium is either the covering or glandular epithelium. Alright, I hope you had a chance to make your guesses. And now let's walk through this tissue together. First of all, this is a really low magnification image. So we're actually seeing a lot, but at low detail. And at the lowest possible magnification, what we can do is just see some patterns and start making the best guesses, as you may have done already. So first of all, I'm seeing a lot of these non-staining area which is the external environment. So that's one environment. And underneath, I'm seeing all this pinkish tissue, which is the connective tissue. So in between these two environments is where the epithelial tissue would be. So I would assume that this is an epithelium. And as I follow these dark staining lines, which I would think is the basalmost layer of this epithelial tissue, we would see the basement membrane coming in contact with the connective tissue. Another thing I see is that this epithelium on this side kind of look about the same. They look fairly similar to each other. But around this area, I think I'm starting to see some transition where the epithelium seems to be getting thinner perhaps, and the apical most surface appears to stain a little more eosinophilic. So this might be a different type of epithelium potentially. And over here as well, we're starting to see some different staining patterns of the epithelium. So this might be another type. So I might actually be seeing 1, 2, and 3 different types of epithelia that are making interesting transitions here and here. Again, I'm just making some educated guesses, but the only way would be for us to start to incrementally zoom in and confirm. But I always like to start with making the best educated guesses first before I start to zoom in, because, context. Also, considering the surface area that's in contact with the external environment here, I would say is pretty big. So I would consider all 3 epithelia to be the covering epithelia. And then we have this kind of business with darkly staining area, which is probably because of all the basophilic nuclei that are crowded together. So I would assume that that's an epithelium in contact with connective tissue out here, and potentially a second environment in the middle, probably a lumen. So since this structure is embedded within the connective tissue, I would consider this epithelium belonging to a glandular epithelium. And furthermore, I'm seeing all these kind of busy looking area that's pretty well circumscribed in a spherical form here also, and here as well. And the reason why these look so busy is because of lots of cells that are crowding together potentially. And wherever I see non-staining area, those could be the lumens as well. So I would think that these circular structures are actually glandular epithelia that are embedded in the connective tissue. So that's my guess. And on this side as well, when I trace the basement membrane of these potential covering epithelium, I'm seeing that I can trace it into this deep connective tissue region where there are some cell busy looking area potentially, and this could be a lumen as well. Here's one too, here's another, so on and so forth. So I would assume that these are also glandular epithelia as well. And lastly, I'm seeing these circular structures with red things in the inside. So this could be one environment. Outside could be another environment with connective tissue, which means that there could be another epithelial tissue there as well. So we'll confirm all of these guesses in the lab video, but for now, what I just did is essentially role modeling how to approach a completely unknown tissue and start to make some educated guesses so you're not intimidated. And with practice, this will get easier and easier.
Thank you for watching this video from the Da Vinci Academy Histology video course, which is completely available on YouTube. To access the corresponding practice questions and histology lab videos, go to our website using the link in the description below.